Hello, and welcome to Mental Health Matters. I'm Edgar Wiggins, Executive Director of Baltimore Crisis Response Incorporated, and your host for this show that is dedicated to providing you with practical and useful information regarding mental health issues and needs. We're going to continue our discussion today of the critical problem of depression. And here with us is Sally Mink, who is the Special Programs Coordinator of DRADA, which stands for the Depression and Affective Disorders Association. Sally, welcome to Mental Health Matters.
Thank you.
Let's start out by talking about what is DRADA, which is a mouthful, and what DRADA does.
Okay, DRADA really has two missions. One is to educate the public on clinical depression and manic depressive illness. And the second is to support people not only with the disease, but also family members and loved ones, because we feel strongly that family and loved ones are as affected as the patient by these diseases.
Well, that certainly is a worthwhile mission. Can you talk about the kinds of educational programs that the organization provides at this point? What kinds of things do you do?
Sure. We have a symposium annually. It's every April. And this coming year, April 2000, will be on our 14th symposium. We always have about 8 speakers from all over the country talk on different aspects of depression, genetics, neurobiology. But we also try to bring it down to earth. We try every year to have a famous person speak to help destigmatize depression. So many people think it's okay to have AIDS or cancer, but there's still a lot of funny stuff around mental illness. So in the past we've had people like Mike Wallace and Dick Cavett, Buchwald, Art Buchwald, come in and talk about their depression. We've actually even had Mrs. Styron, who's wife to William Styron, who's written the book, talk about what it's like to live with someone. And also Katharine Graham, whose husband was head of the Washington Post, who committed suicide, and just how tricky it gets living with someone who's unpredictable and depressed. You know, along with the symposium, we have what we call membership meetings. They don't require any money to attend. We're actually having one on September 23rd of this month. And Dr. David Goodman is going to talk about the relationship of attention deficit disorder and depression. There's a great overlapping, and often they're misdiagnosed. And this will be discussed on the level of adults that suffer from ADD and depression.
Well, the thing that strikes me as you're talking about people who are well-known, who have this disorder and this disease, is that really depression and the problems associated with depression can really affect anyone. And yet, as you said, there seems to be still this problem of stigma. When we look at depression as an illness, what's your sense of how many people this affects?
It can affect as much as 10 to 15% of the population. Actually, 80% of people that suffer from depression, 80% never get diagnosed.
Really?
Which is, to me, is just incredible. A lot of people are walking around out there suffering needlessly. They're either losing jobs, having problems with relationships, dropping out of school, fighting with friends, losing friends, and they may blame themselves. A lot of times they blame other people, though. But they actually have a medical disease that originates in the brain. It has to do with neurotransmitters. But so many people still see it as a weakness or a fault. I think one of the other misgivings is that depression appears as sadness, and it really often is irritability. I think kids get away with, particularly adolescents get away with this irritability. They're seen as sort of hormonal hurricanes. No offense, but I think a lot of men get away with tempers and irritability, and that's the way they express this sense inside that they really feel lousy. Another interesting point is that a lot of people will feel they don't feel good. They can't pinpoint it, so they'll go to their family physician, and he'll either, you know, pat them on the head and send them on their way because he can't find anything that's wrong with them. And 75% of those people who go in for these non-specific reasons will commit suicide a month later. They're so discouraged and really demoralized because they feel lousy, and nobody can find anything, and they end up just sort of giving up.
When you talk about depression and feeling lousy and feeling irritable and losing friends and fighting with folks, these are all things that sound like part of the human condition.
Right.
How is it that we move from there? I'm having a bad day and it just happens that I've had 20 in a row, to understanding or diagnosing this as a medical disease. What else do people out there watching need to know about how we begin to put a picture together of depression?
Well, I think that's a very important point. One thing is we look for a cluster of symptoms. We all have bad days, and we can have a lot of bad days in a row. We can have sleepless nights. We may not be hungry one day and stuff ourselves the next. But it's this clustering of several symptoms at the same time for more than a month that you really need to sort of wake up and look at things. The sense of hopelessness, of feeling guilty, either sleeping too much or not sleeping enough. A lot of people will have early morning awakening, wake up at 4 or 5, and they may not even get out of bed, but they can't get back to sleep. On the reversal, they may not be able to get to sleep. Eating can be, when they feel anxious, they'll tend to not be able to eat, and they'll start to see that they've lost weight. There's a big percentage of people that overeat, and then they start to crave carbohydrates, and they sort of sit around like couch potatoes. And so they'll see a significant increase in weight gain, and that's often paired with the oversleeping too. Lack of energy. You could be a really energetic person that's always involved in a lot of projects, and then all of a sudden you really lose your oomph to do things. So it's a group of things. Also, having suicidal thoughts, not necessarily planning your suicide, but just wishing you wouldn't wake up. Things like that. Anxiety, again, can be a symptom. Panic attacks, just being over anxious about things that, prior to the episode, you could just sort of take it in your stride, but all of a sudden things get really overwhelming.
So this cluster of these symptoms indicate...
For a sustained part of time.
A sustained period of time, okay. Indicate that we probably are looking at a depressive disorder. Why then is it so difficult for people to reach out for help? I mean, you talked about a significant number of people going in for, feeling lousy, the doctor not being able to find anything wrong, the family doctor, and then them ending their lives within a short period of time later. I mean, that's a very startling thing. Why is it so difficult for people to reach out for the appropriate mental health or psychiatric treatment?
I think there are a lot of reasons. I think, for one, people just see this in this day and age, that this is a part of life. You know, we all have stress in our life every day. I'm sure if I asked you, you know, to name me some reasons why you could be depressed, we both could come up for reasons right
How much
now.
time do you have?
Yeah, really.
It's a short show. Go ahead.
But we always say it's because of this, it's because of that, it's because I lost my job, it's because my kid is being bratty, it's because my husband's a jerk, it's because I'm, you know, a caretaker for my sick mother. We don't see this as a disease entity. This is a medical disease, a treatable medical disease. And what people just, they associate it with feelings. They don't think of neurotransmitters misshooting in their brain. We've always seen it as somebody's weakness. And we always can find reasons why we would be depressed or feeling lousy.
And so we as Americans need to have, you know, stiff upper lip and kind of keep pressing on,
Right.
regardless of how badly it feels, and to reach out to a mental health professional, therapist, counselor, or an organization like DRADA to find out about more about it, which is a weakness, it's a sign
Right.
of weakness. And something to be avoided at all cost. You've clearly, though, articulated the downside of not doing that, which is suicide, failed relationships, lost jobs, and ultimately feeling pretty bad about oneself. What about the other side? What kind of results and relief might people expect from trying to get some assistance, get some education?
Well, that always brings happy thoughts. That sounds sort of trite, but I have seen people get into treatment that have lived with this disease for their whole life, and medication and therapy can just, they feel like their lives have been given back to them. Some of them can't even remember when they have felt normal. Because I'm associated with Hopkins, I talk to a lot of the psychiatrists, and most patients aren't diagnosed until they're 40 or 50 years old, and yet they can remember as teenagers feeling depressed and out of whack, and having various symptoms, sort of dropping out of their group of friends and stuff. And I just think it's so sad that people can spend decades wrecking their lives. The other interesting part is the longer that you, now this is not in all cases, but significantly research shows that the longer the disease goes untreated, the worse the disease can become, i.e. they may have an episode at 15 and then 21 untreated, then it may be 24, maybe 26, and not only do they come shorter, but they get worse. The depressions last longer and they deepen. And, you know, someone's life just goes really downhill.
Well, I wanna talk a lot more about some of the things that your organization is doing, and I want to come back to talk specifically about some of the things related to adolescence and some of those special projects that you're working on, but we need to take a break right now. We'll be right back with Mental Health Matters.
Batteries and flashlight. Okay, you know what?
That guy? Look,
Okay, girls, 3 o'clock.
what is he looking at?
They're looking at us. What do you think?
Oh, that's so obvious. Captain Obvious has scored again. Oh, you wouldn't say something.
Oh, he's really in it now.
Hi. Hi.
Hey, guys.
Hi.